Hello, this is Kevin Porter for Congress, and today we're going to talk about why everyone should have access to healthcare if they want, and how that can happen as a nation in a good, effective, and competitive and financially beneficial way. So, who am I? My name is Kevin Porter. I'm running for Congress in District 11, just west of Orlando, in Florida, though this information is pertinent for everyone. Essentially, so what is our issue? What is going on? What do I mean about healthcare? Now, there are certain people that don't wish to have healthcare for whatever reason it may be. Maybe they live in the countryside. They take care of things themselves. They're always healthy as a horse. So there's others that require healthcare. The issue we're facing as a country is the healthcare prices are absurd. They are insane. I'm sorry, but we have some of the best quality of healthcare in the world, yet our prices are the absolute, without a doubt, highest healthcare costs in the world. Why is that, and how can that change? What can we do to get access to good healthcare? Now, you hear a lot of left liberals talking about implementing universal healthcare, like in Scandinavia, Denmark, Sweden, Finland, and so on, where they have universal healthcare, where Canada, I think, does too, and England as well. I'm going to tell you about the pros and cons of that. I'm going to tell you the pros and cons of the other way, so we can come to consensus and understand what's going on. I lived in Denmark for over 15 years, and I was able to really understand how the system works there, how they function as a country, the Copenhagen model, as Bernie Sanders or whoever calls it. I lived it. I was integrated into it. My wife is Danish. We have 4 children, so we're in it. The healthcare system, school system, everything. And you don't have a choice. It is what it is when you live in the country, right? Though I was able to see the pros and cons for both sides of the argument, in the sense that, you know, the extreme left may send you, or whoever is for us, some people on the right maybe too, but they'll send you this vision of utopia. Oh, everyone has a healthcare. They can just go free healthcare or free education or free whatever. There's no such thing as free. There's no such thing as free, first and foremost. If you do some type of universal healthcare, everyone has to pay for it. Though, like anything else, when the government is running something, it usually can be done better, right? And we see that. We always talk about government services, like, oh, I got to deal with government services. I had to deal with this bureaucracy and that. So, a government is essentially a giant business in a way that has no competition. And if a business has no competition, they do things the way they want to do. And they don't have so much concern about how things are done. There are exceptions, of course. And so what happens when you run a universal healthcare maybe a Freudian slip, I don't know, a universal healthcare system where the taxpayers pay for all the healthcare in the country, you get a very interesting scenario and situation. What happens is that the hospitals are overpriced in many ways, inefficient in many ways. The salaries are really low for health workers. Like, in Denmark, if you want to start out as a registered nurse, you go to the same education as anyone else, but you'll make a lot less than in the private sector, a lot less for everything. Technology isn't there. The innovation isn't quite there. They may be good at some things, but not at others. Huge waiting lists. I mean, insane waiting lists for simple surgeries because they have a capacity they can, max reach. Let's say they have a budget for $3 million in a certain department, and but they have way more demand than that, and they can't get the budget up because they can't find the money or whatever. Those government situations, and what happens is then you have issues with people who are sick, especially people who are sick with very rare sicknesses or less common sicknesses. They have a hard time. Obviously, the advantage is if someone does not have money, can't afford healthcare, well, then they can go to and have access to doctors and hospitals. And how they do it, and essentially in Denmark, the universal healthcare model, a lot of people talk about in Scandinavia in general, is that the doctors are private, if that makes sense, but they're paid by the government. It's kind of tricky. So the doctors, all they care about, and they're the only ones, so all they really care about is getting as many patients through as possible because they get paid per consultation. That's how they make their money. They get a certain amount from the government per consultation. So you go to a meeting with a doctor, and it's like crazy how fast it is. First, you have to get an appointment, a priority appointment. If something's bad, they have some priority, slots open. Get a priority appointment with the doctor. You get in there. You're lucky if you get 15 minutes in a consultation that's 15 minutes long. You're lucky. Usually it's like 10, 5, because they make a certain amount of money per consultation. And they'll slot you in the calendar as like 15-minute appointments, just back to back all day long. And they make a ton of money doing that because their interest isn't so much about the benefit and well-being of the patient. Obviously it is in a way, but they're just under huge pressure to make as much as they can, get as many through as they can. And some of the reasoning for that also is because they just lack the resources as well to attend to more patients and so on. So, that makes it also so when you have universal healthcare that people also abuse the system. Every time there's a cough, every time there's a little this or that, they're going into the doctor. They're going to the doctor, right? And that increases the cost for everyone because everybody's paying for it. So obviously the good side, like I said, is you don't have to think about it, especially if you don't have money, but you're paying for it. You're paying, I don't know if it's in Denmark, how much it is. I think it's like 8% of their tax goes to healthcare, something like that. A big, huge portion. That's a lot of money. 8% of your salary, imagine that 8% of your salary going towards healthcare. Maybe it could be similar to what you're paying these days, with healthcare, or more or less, but then you don't get the quality. Now, I believe then the other side of the spectrum. The other side of the spectrum is our model in America, where we are more so like it's health insurance based. I'll give you an example. When we were living in Denmark, we went to visit my family. We're in Phoenix, Arizona, the Phoenix, Arizona area. My son got strep, or we thought he had strep. We wanted to bring him to the hospital, get him checked out, make sure everything's okay. And we have health insurance, travel insurance and so on. So we're going to the doctors or the hospital, run a couple tests, and then in comes, and it was a great service, wonderful service. I mean, great service. As a children's hospital, and all of a sudden whoever it is comes in to give us the bill, and he says, "Well, what's your insurance?" And we say, "Excuse me." Oh, a little tired today. Then we say, "Well, we have travel insurance. So how do we do this?" And he says, "Well, you're gonna have to pay for it, and then you have to take care of it with your travel insurance when you get back to Denmark." I said, "Okay, how much is it?" And he's like, "Actually, I'm embarrassed. Embarrassed about what? How much the price is? Because usually we just get the insurance card, we run off and charge the insurance. But, you're going to have to pay $500. I said, $500? We spent like half an hour, 45 minutes, ran a test, simple test, $500? He's like, yeah, I know, I'm really embarrassed. I'm really sorry. That's the only way to do it. So I had to go down the payment area, and I had to pay $500 for my kid to get a simple test. Went back to Denmark, got the money back, thank God. But it just goes to show you what? That if they're embarrassed to tell you how much it is, because when you got to pay out of pocket, should they be charging the insurance companies this exuberant amount of money? Isn't something wrong? Isn't something very rotten if that's the case? I've heard of people getting surgeries that cost $100,000, $200,000, $500,000 or more, millions of dollars even. How does that even happen? How is that even possible? And the amount they charge you? Well, one of the things I know is back during the Trump presidency, his administration, they worked on getting a law through where it allowed transparency between hospitals. So like you as a consumer, you need to get knee surgery, right? Well, you have a way to you get transparency about the pricing from the different hospitals, and you can compare and shop around. Maybe you do for a used car, you do for something else, or electronics. Why can't we do it with hospitals? Why does it got to be this secretive thing where your insurance only works in the certain corporations and others? And this also does what? With insurance costs being so high, they're so high because the hospital costs are out of this world. It's insane. Then people can't afford insurance sometimes. If they don't get benefits, they don't get it. Or people who are older, their insurance premiums will be so high that, well, they can't afford it either. So how do we fix all this? Well, we amend it. We create a hybrid solution. And what's a hybrid solution? First, transparency. You need to get transparency in there. These hospitals need to be transparent about everything and public about what they're doing. You need to be able to compare costs. You need to be able to shop around. There needs to be websites. Maybe there is already, but I don't think there is. But there needs to be websites out there that allows you to go shop for this cheapest knee surgery and get the best ratings. Hey, this hospital does this knee surgery, costed this much. Oh, they do it for $5,000 or they do it for $3,000. You know what I mean? Shop around. That competition reduces prices. But when it's secretive, it doesn't. Another thing too is we need away for our health care coverage. So that will bring our insurance premiums down, going back, our insurance prices down, our payments down, because once you get competition between the hospitals, that in general just creates a competitive market where they're better and better at slashing prices and doing things more efficiently to bring the cost down. Now, what about people who can't afford insurance? Well, first and foremost, if you bring the price down for insurance, right, or for insurance for healthcare in general, you get those prices pushed down. It's much easier to help out the people who don't have insurance and get them insurance and get them on board and get them the treatment and the help they need, right? Through the form of different benefits, right? I'm not for increasing taxes. I'm for slashing taxes. I'm for spurring economies. I'm for spurring growth and innovation. And there's many solutions we could do, but what if the job, the employers, they get benefits, they get tax reductions, they get stimulation for them to lower or not to lower, but to increase the amount of insurers, people who are insured for healthcare, right? What if, we're able to redirect a lot of these funds that are currently being used, because you have, what they call the Obamacare or whatever in many places, you redirect the funds being used for programs like this towards these people who just flat out can't. They have no way to pay for it. Veterans usually get health care, but like retirees, why do they have to be let out in the cold as far as healthcare goes? Why should they have to be bankrolling these insane healthcare costs, right? We should take care of them. I believe that. We're the workforce. They did their workforce to take care of they worked to take care of us. They worked to build an economy for us, to serve us, and so on and so forth. Why can't we work to take care of them? Or to take care of you if you're watching and you're a senior? It all has to be a balance about it, right? Because we have to remember that our country was founded on the principles that all have the right to life, liberty, and the pursuit of happiness endowed by our Creator. That's from the Declaration of Independence. Now, with that thesis or that mindset, then we know what we should and shouldn't do, right? Life, have the right to life. So if you don't have the right to health care, do you have the right to 100% the right to life? No, because what if you're sick? What if you get a curable disease or sickness or something or whatever it may be that can be taken care of, but you can't because you can't afford health care, or your health care provider or your insurance provider won't take care of it, won't cover it all, whatever, you know what I mean? So that's something we need to change up. So summarizing, we need to bring the cost down, bring in transparency in competition. We need to bring, that comes through transparency, that comes through truth. People knowing what's going on, just making it public, making it known what people charge. Like every business should be honest about what they charge. I mean, come on. Everywhere I go, there's always a price list or whatever where you can see how much things are. When you go to the restaurant, you order some food, they don't just come with a surprise bill and say, oh, that's $300 for dinner. No, you got a menu you're ordering from, you're choosing, I want this, I want that, I want this, I want that, and tip and so on. It should be the same with healthcare, dentistry, whatever. It should be the exact same. We need to have a free, open market that allows competition to push prices down. We need to spur innovation and spur efficiency and so on and so forth. Another thing that brings healthcare costs down is actually healthy living. You probably heard of this as well. Eating healthy, living healthy, exercising, so on and so forth. Those are the things that will bring healthcare prices down the most in this country. So our country needs to spur healthy living. Not by controlling what you do or don't, that's up to you, but by spurring and making it more accessible for you to get the kind of food you want or the exercise you want. That doesn't mean the government's paying for it. It just means the government is stimulating innovation in those areas, right? Innovating and stimulating healthy food, organic food especially. We need to get away from all these pesticides, all these chemicals. It's hurting us. And those things, this can't be proven yet, but it's suspected that a lot of that is what causes, cancer and other things. So we need to spur healthy living, spur a healthy lifestyle. That's going to be the biggest factor in bringing down healthcare costs is being healthy, not being sick, right? And the best medicine for your body is healthy living. It's healthy food, healthy, good exercises. So that's the first, right? That's the core for anyone. And then obviously breaking up our healthcare mafia, getting transparency in there, taking care of the people who need it, and that's how we'll move forward. It's a win-win-win that way. That we don't have to worry about like, oh my gosh, taxpayers, we can't take care of universal health care and so on and so forth, which we shouldn't. But we do need to take care of the weak. We do need to take care of the less fortunate, and we do need to take care of our seniors, veterans, and so on. And with this solution I'm talking about, that will allow it. That will bring it. And I'll fight for that. So once again, thank you so much for participating in this live. Don't forget, or this video, don't forget to share it, like it, follow me. Also, while you're at it, while it's still available, grab my free ebook, Reviving the American Dream, 3 essential steps to winning back our country before it's too late. This is a free gift for you. All you do is you find the link above or below this video, or if you're on my website, you should see a button around there saying free book. It's an ebook. It basically outlines more about what I've talked about, the 3 essential steps to get our country back on track, okay? Free gift for you. You download it right away. Thank you so much for participating in today's video. I wish you all the best. And don't forget, midterms are coming up soon. Don't forget to vote for me, Kevin Porter, for Congress, District 11, just west of Orlando. All right? Have a great one. Take care. God bless you. God bless you.